Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Younger Onset Dementia, sponsored by Prince George's County Government and the Department of Family Services.
Tonight's webinar is Younger Onset Dementia. My name is Lindsey Vajpeyi, and I'm with Insight Memory Care Center. Insight Memory Care Center is located in Northern Virginia. We are a nonprofit organization, and our mission is to provide specialized care, support, and education for individuals living with Alzheimer's disease and other memory impairments, their families, their caregivers, and the community through our Adult Day Health and Resource Center. Our vision is a community where those affected by Alzheimer's and other memory impairments can achieve the highest quality of life. So, I have a few questions here on the screen, and maybe one of these questions is what brings you to the webinar this evening. Does dementia run in your family? Are you concerned about a family member, a friend, neighbor, colleague, maybe even yourself? Do you know someone with dementia? And is that a concern? Oops. There we go. Do you know someone with dementia at a young age? So you might be answering yes to one of these questions. Throughout tonight's presentation, I'm sharing a handful of quotes from a caregiver of a person who's living with younger onset dementia. And this is the first quote that she shared with me when I told her I was preparing tonight's class. And I thought it was just a really, just a very powerful way to start. She says, "I wish I had known that early onset dementia even existed." And I think that is, this question is so much more common than most of us realize. So for her, when her loved one was going through the first symptoms and getting to the point of finally receiving a diagnosis, this just entirely blindsided their family. So I wanted to start this evening by talking a little bit about terminology to make sure that we are all on the same page here. So when we say dementia, we mean that there's a loss of cognitive functioning to such an extent that it interferes with the person's daily life and activities. And when I say cognitive functioning, this could include memory loss, which is what most people think of, but it might include other cognitive functions, things like executive functioning, communication, visual spatial abilities, social abilities, behavior, or other types of cognitive changes. So this is not exclusive to people living with memory loss. There are many different types of dementia. Alzheimer's is the most common form of dementia, but it's certainly not the only type, and we'll talk a little bit more about that in a bit. I also wanted to clarify the term that I've chosen to use this evening, which is younger onset dementia, and to say that it is the same as what other people sometimes refer to as early onset dementia. So if you or a loved one has been diagnosed with early onset dementia, we're talking about the same thing this evening. However, I choose to use the word younger onset dementia because we often describe dementia in stages, and one of those stages is early stage dementia. And I find that people get early onset dementia confused with early stage dementia, and they are not the same thing. Someone could have younger onset dementia, but be at any stage of the journey. So I will call it younger onset dementia for our class this evening. So what is younger onset dementia? It is any form of dementia that occurs in a person under 65 years of age. So that's kind of the magic number when we call it younger onset dementia. We are not talking about a specific type of dementia when we talk about people who develop it at a younger age. We will talk a little bit about different types of dementia and risk for people who are younger, but we're just kind of talking more generally at this point. For someone who has younger onset dementia, their symptoms and the treatments that are available to them are not any different than for somebody who has dementia at an older age. However, with younger onset dementia, getting a diagnosis can be more challenging, as there are many other conditions that can produce symptoms similar to dementia. So oftentimes, the first things that someone might, like a physician might be looking for in a younger person might be something like depression, anxiety, menopause, what we might call midlife crisis, might be mental health condition, addiction, brain tumor, alcohol use. There could be a lot of other things that a physician would be looking for first before they really get around to identifying an irreversible form of dementia due to a disease like Alzheimer's. So how does one even get to the point of a diagnosis? Well, it certainly starts with a physician, usually a primary care doctor, who will kind of go through the first diagnostic workup, and then often the person will be referred on to a specialist such as a neurologist. So there would be a detailed medical history taken, identifying any current medical conditions, former medical conditions, family histories, things like that. Medications that are taken, how well do you sleep, are you experiencing any mental health changes, blood pressure, all of those sorts of things. So there'd be that thorough physical and neurological examination. There would be pathology testing, things like drawing blood and checking for things like vitamin levels within the blood or infection. There would be brain imaging, CT scans, PET scans, MRIs, and the like. There might be psychiatric assessment, especially for someone who has younger onset dementia. There may be a more thorough psychiatric workup to ensure that it is not a psychiatric issue that's causing these symptoms. And there would likely be a neuropsychological assessment, which is basically in-depth cognitive testing. So what causes younger onset dementia? Well, the most common cause of younger onset dementia is Alzheimer's disease. And when someone has Alzheimer's disease at a young age, it's possible, though not likely, that it's due to a familial type of Alzheimer's. There are 3 different genetic mutations that can be passed from generation to generation. And if someone inherits one of those genetic mutations, they really, if they knew about it, if they had genetic testing done, if they saw this family history, they would know with pretty nearly 100% certainty that they would likely develop Alzheimer's also at a very young age. But that's extremely uncommon. For most people who have younger onset Alzheimer's, they may have certain genes in their family that make them more at risk for developing Alzheimer's. Just carrying those genes does not mean that someone will definitely get Alzheimer's. It just increases their risk compared to someone who does not have those genetics. And sometimes, even at younger ages, people can develop Alzheimer's disease that we call sporadic. There's no genetic cause for the development of the disease in this younger person. It just happens. So for all people living with dementia, less than 1% of them have younger onset Alzheimer's disease. Of all people with younger onset dementia, about 11% of them have younger onset Alzheimer's disease. But there are other causes for younger onset dementia that could include vascular dementia, when there is a problem with blood flow in the brain. Frontal temporal dementia is a type of dementia that tends to occur in younger people more frequently than it does in older people. When I say younger people, I'm usually talking about 50s, early 60s would be onset. However, it can occur in people even in their upper 20s, 30s, and 40s, which is of course much more rare, but is possible. And about 20 to 40% of people with FTD, frontal temporal dementia, have a family history of some type of dementia. There are other diseases that can cause younger onset dementia, including dementia with Lewy bodies, Parkinson's disease, Huntington's disease, MS, or HIV infections. If someone has chronically overused alcohol over many, many years, that can cause irreversible changes in the brain that would fit in with younger onset dementia. And people who live with Down syndrome may also develop younger onset dementia. Typically in someone's 40s or 50s, the person with Down syndrome would develop something that looks very similar to Alzheimer's. It may be Alzheimer's, but it's also possible that it's not quite the same. The person with Down syndrome may not have this same level of plaques and tangles in their brain, even if they're showing very similar symptoms as Alzheimer's disease. So there are some of the reasons why someone might develop younger onset dementia. I again, which means under the age of 65. So genetic testing. There is genetic testing available. If you are concerned about a family history of dementia, this might be something of interest to you. However, I very, very strongly encourage you to talk with a genetic counselor before pursuing genetic testing. So there is diagnostic genetic testing, which is for people who have a diagnosis and a strong family history. And there's also predictive genetic testing for those without symptoms, but who have a high risk of inheriting dementia. So if you are here on the webinar tonight already with a diagnosis and you are thinking about genetic testing, that would be that diagnostic genetic testing. If you're here maybe as an adult child who has a parent living with dementia and you're interested in your risk, that would be that predictive genetic testing. But there are really some pros and cons to consider if you're going to pursue genetic testing. On one hand, one of the advantages of genetic testing is it might help you prepare more for the future if you knew what was in your future. But on the other hand, knowing this type of information and having it recorded and in your medical record might get in the way of you being able to pursue certain benefits like life insurance policies, long-term care insurance policies, disability benefits, and the like, as well as the emotional impact that it could have on someone if they learn that they carry genes that give them a high likelihood of developing dementia in their younger middle age, younger adult years. So it's certainly something to discuss with a genetic counselor. So this is another quote from that same caregiver that I referred to earlier. She says, "I wish people understood the emotional impact of all the things the family of someone with early onset dementia are losing, that the family of a typical dementia patient in their 70s or 80s has probably already gotten a chance to experience. Think of being a grandparent or of walking a daughter down the aisle, for example." Right? The dynamics are so much different for someone who has younger onset dementia. There may be feelings of shock, loss, sadness, or anger when someone is diagnosed with younger onset dementia. And when I'm saying this, I mean, this really could be for the person who's receiving the diagnosis, but it could also be for their loved ones, those family members and friends that are nearest and dearest to them, that everyone may be going through a form of shock or a form of grief, really, anticipatory grief, grieving the changes that you are anticipating in the future. Maybe that's thinking that you would have a certain type of retirement together with a spouse, or a certain amount of time together with a parent to go through different life milestones, and anticipating that the person may not be available for those things as you had always dreamt. You might find that others don't believe that you have the disease, or they might question the diagnosis because of the young age. No, it couldn't be Alzheimer's disease. You're only 45 years old. The doctor must have gotten it wrong, right? So there may be things that even family members might be in disbelief, or friends and neighbors and people who are in those social circles might exhibit some of this kind of disbelief or questioning of the diagnosis. For somebody who has younger onset dementia, it's possible that they might lose relationships or jobs, more due to the misunderstanding that may occur due to the symptoms. The things that may be happening, the people around them don't realize that it is due to a disability or to an illness or an underlying disease. And so that person may have marital conflict, for example, for years and years before symptoms ever become sort of bad enough that they get to the point of being able to be diagnosed as due to a disease. Or the person might be fired from their job before we realize that those symptoms that were causing them to be ineffective at their job were actually due to an underlying disease. When somebody has younger onset dementia, the person is more likely to be working, to be raising a family, maybe high school, college-age kids, maybe even younger. The person may be financially responsible for their family, maybe the household breadwinner, or certainly their financial contributions are relied upon to maintain the family. The person may even be caring for older parents, when they're diagnosed with younger onset dementia, or their spouse is diagnosed with younger onset dementia. So there's just again a really a different impact when someone is at this very different stage of their life compared to someone who might be post-retirement, maybe in their 70s or 80s or 90s, developing dementia. So this caregiver also says, I wish people understood just how hard it is for a spouse of someone with early onset dementia to balance care for their loved one with the need to keep working, pay for private sector health insurance, and all the other trade-offs that you often still have to make when you have an early onset patient. Right, there's so much on the shoulders of, for example, in this case, the well spouse, or maybe the very young adult children, to keep working because of that need to work, to be responsible for the household, to be responsible maybe for children, and to be the breadwinner, and while also going through the stressors and the grief that come along with being a care partner to someone living with dementia. So the impact on families, and first I'll start here with couples. There may be changes to that relationship, right? The roles within the household may change. The way that the couple interacts with each other may change. Things like intimacy and sexuality may be something that's changing when a person is experiencing dementia. So one of the things that families, couples specifically, could do is to talk about what kind of help you need from each other, and really trying to cultivate this feeling of teamwork, having this sort of team approach to everything that's going on within with this disease and how it's affecting not just the entire family, but the two of you as a couple. Communicating what you need from each other and really trying to be open-minded, trying to build trust, and really, again, trying to travel this journey hand in hand together and not to become adversaries. Couples can continue participating in as many activities as possible with their partners. This sometimes means adapting favorite activities. So for example, things that you used to do together, let's say it was going hiking in the mountains. Well, maybe that doesn't quite work out like it used to, but that doesn't mean that you couldn't go for a shorter hike somewhere nearby. Or maybe you find a new activity that you enjoy together as a couple. For many couples, especially households where maybe you have dual income and different responsibilities with children, with neighborhood organizations, with hobbies, you might have led very separate lives, really. And this might be a time to try to find an activity or two that you truly enjoy doing together. And maybe that's going for an evening walk after dinner each night, or watching a funny sitcom on TV, or playing a game of Uno, finding something that you enjoy doing together. Couples can discuss how and when to tell other people about the diagnosis. Oftentimes, you're telling adult children first, but when do we tell our extended family? There might be siblings that are someone who needs to be told. Maybe there are grandchildren, maybe just other extended family. And when do we tell them? How do we tell them? How much do we tell them? When do we tell our workplace? When do we tell other people who are close to us, people we might see through our faith community, our friends, our neighbors? And this can be a very personal decision from one family to another, who to tell, how much to tell, and when. And finally, families and couples specifically might find it helpful to find a counselor who works with couples facing issues that you feel challenged by. And often, again, this is changes in sort of those roles and responsibilities at home, in the dynamics of the relationship, and often intimacy changes as well. Now, what about kids? So if we're talking about somebody with younger onset dementia, maybe they're in their 40s, 50s, early 60s, it's quite possible that they have children at home, or young adult children, or possibly grandchildren. And kids, especially when I'm talking about kids, young kids, elementary, junior high, high school age kids, they may not always understand what's going on, especially the younger the child, the less they are aware of what's causing these symptoms. You know, where a high schooler could do a little bit of research about something like Alzheimer's disease and might have at least a little bit of knowledge about diseases like that, an elementary school child may not have that type of understanding. Kids will sometimes feel that they are to blame for this disease. They are to blame for the symptoms that they're seeing in their loved one, like their parent. This might produce anger in the child, acting out, other kinds of behavioral changes. So there can be some real psychological behavioral impacts on kids when they have a parent or a family member who's living with younger onset dementia. So you want to try to find activities that you can do together with your kids that both parties find enjoyable and manageable. We want to stay engaged and talk with children honestly about what you're experiencing, if you have younger onset dementia or if you're sharing about a family member, but you're talking about it in an age-appropriate way for that child. Again, talking to a 6 or 7-year-old, that conversation might look much different than if you were talking to a 13-year-old, which would look much different than talking to a 17 or 18-year-old. So you're sharing as much information and in a way that makes sense to the child depending on their ability to understand and comprehend. You could consider finding a support group for children. There are some that exist, not a lot, but sort of since the pandemic and this era of Zoom, it's at least easier than ever to access resources like support groups for children, which might not be available in your geographic area, but might be available through programs like Zoom. And invite your kids to some of your counseling sessions. If your counselor thinks that that would be a good idea, that might be really helpful for the children as well. You want to make sure that your child's school counselor and social worker are aware of this diagnosis within your family, you know, and being able to have conferences, to have conversations with the school support staff so that you're on the same page about how things are going for your children. And you might also consider keeping a written, a video or audio record of your thoughts, feelings, and experiences for your children. This can be really, really meaningful to them down the line. And so while the person is still capable of doing these sorts of things, this can be a really great way to leave some mementos to those younger children. How about work? Many people who are diagnosed with younger onset dementia are still working. You know, most of us are working well into our 60s and sometimes even into our 70s or beyond. So you do want to have these conversations with your workplace sooner rather than later. You do not want to wait until the person gets to the point of potentially being fired from their job before having a conversation with the workplace about what's going on. So find out if you can switch to a different position. You know, maybe you're still capable of working, but the current position no longer is a good fit. You might consider reducing your hours, working a more convenient schedule, for example, doing some telework or working shorter days, potentially lightening the workload or taking some time off if that's what's needed. You and your care partner need to familiarize yourself with what benefits you can receive through your workplace. For example, some companies have what's called an employee assistance program. And that would be really helpful to know. That gives you access to different kinds of services. In many cases, that includes things like counseling services or visits with financial professionals. You also want to explore what benefits might be offered to you under the Americans with Disabilities Act, the Family and Medical Leave Act, which gives you, if you're in a company with at least 50 employees, gives you up to 12 weeks of unpaid leave each year. And COBRA. So COBRA, you can, before you leave a job, you can sign up for COBRA, which is a way to extend your health insurance even after you've left your employer. So if someone were to lose their job or leave their job before disclosing this diagnosis, they may not have an opportunity to take advantage of programs like COBRA, which could extend health insurance for a longer period of time. So again, here we want to talk with our workplaces sooner rather than later. Another quote, I wish I had known just how complex and time-consuming it would be to navigate the world of Social Security, Medicare, and other entitlement programs that become even more complex for early onset patients, since they aren't geared towards Americans under 65. So finances, this becomes, I mean, aside from the emotional impact that this has on families when there's a younger onset diagnosis, finances is a really big stressor for families, right? This person typically is still working. So it's really important to talk with a financial planner as well as an attorney to help you plan for your future financial needs. Making sure that you have all of your legal and financial documents in place. Things like estate planning documents, advance directives, powers of attorney, wills, trusts. We should all have those things, all of us, all adults, even without a diagnosis of dementia or any other type of illness. But it becomes especially important to make sure that you have these documents in place when there's a diagnosis of dementia. And if you already have the documents, that's great, but it's time to pull them out and review them. Review them with a professional if possible. Maybe some of the decisions that you had made in the documents that you drew up 10 or 20 years ago, you might have different feelings about that now. Or for the well spouse who may have appointed their spouse as their power of attorney, if that spouse now has a diagnosis of dementia, even the well spouse may need to update their documents to choose a different power of attorney. So we talked about asking your employer about benefits through your job. Maybe early retirement would be an option. So again, this all comes back to that communication. You want to explore what benefits might be available to you through Social Security, as well as Medicare and Medicaid. And this is complex. I mean, this is not something we're going to be able to cover in depth this evening, but Social Security, disability insurance, Social Security income, these are things that you could start looking into sooner rather than later. And there are attorneys who can be especially helpful in this area as well to help you identify which sorts of programs that you qualify for, and also to help you with those applications. And if you receive a rejection, having an attorney on your side can be really helpful to apply again. So also organizing financial documents and making sure that your spouse or your partner understands and can manage your family's finances. So you may have had sort of division of responsibilities within the household where one person managed the finances, but this is a time now where we need to come together and to make sure that everything is in order and that the well spouse or that care partner has access to manage the family's financial resources and financial accounts. So she also says, I wish people understood how hard it is to make the emotional shift of planning for a future without your spouse, often after having spent 20 or 30 years jointly planning that future. And no doubt, this is extraordinarily hard. This is something that I wish no one ever had to go through, but unfortunately, this does happen. I didn't mention earlier, but a statistic would be that there are at least probably a quarter million Americans who are living with younger onset dementia due to one cause or another. So this certainly does affect people in our community. There are some resources available that I would encourage people to look into. One resource is to consider getting involved in a clinical trial. If you are here in the District, Maryland, Virginia area, we have great access to clinical trials. We have Johns Hopkins, which has a younger onset dementia clinic. We have NIH, we have Georgetown, and other great institutions to get involved in research. And when we're in a position where we feel really powerless, this diagnosis has been made and we don't want it, yet we can't change it, this gives something that we can do to be active, something that we can do that potentially would provide a helpful treatment for the person with the diagnosis. If nothing else, the placebo effect, it gives you more access to experts in the field and it contributes to a body of science. So if your younger onset dementia is due to something genetic, being involved in research is something that you could do for your children, for your grandchildren, and future generations. Where you can find clinical trials is clinicaltrials.gov, and there's actually a pretty easy search function there. You can click on a button that says you're looking for trials that are currently recruiting. You can put in your zip code and give a certain mile radius that you're willing to travel to be involved in a trial. You can choose a specific disease, for example, FTD or Alzheimer's, or type in a keyword and do a quick search and find clinical trials that might be appropriate for you or for your loved one. It gives you a little bit of information about each trial and who to contact to learn more. Another thing to consider is to keep a folder of resources that you might need as the disease progresses. So we didn't talk about stages, but for anyone who's experiencing a progressive form of dementia like Alzheimer's disease, dementia with Lewy bodies, FTD, vascular dementia, or others, things will change over time. So while someone might start in the early stage of the disease, eventually their brain will continue to change, their symptoms will change, and that means that their needs will change. So really trying to learn about those resources sooner rather than later, learning about them before you get to a point of truly needing them, right? We don't want to wait till there's a crisis that occurs and then try to put a plan in place. We want to understand what resources are out there and start utilizing them, earlier on. So learn about what's out there, seek out information. There is an evidence-based care planning program called Share for Dementia that helps families living with early stage dementia plan for the future. It's a 5-week series where a share counselor would work directly with a family that's experiencing dementia, the person with the diagnosis as well as the primary care partner, and would help that family understand the diagnosis, talk about communication, values, preferences, sources of support, and really help that family to write a plan for the future. As help is needed in different areas, who can we turn to at that time to help us? And also picking up some tips along the way of how to live well today with dementia. So I encourage you to look into the SHARE program. Insight does offer the SHARE program, and even virtually over Zoom for those who don't live in our geographic service area. But there are other SHARE counselors all around the country. So you may be concerned about a family member who lives in Ohio. There may be a SHARE counselor in Ohio who could help your family. Another resource is education. The more you know, the better you do, right? The more you know, the more access you have to resources, the better decisions that you can make. So for care partners especially, pursuing education to understand the disease, understand the symptoms, and to learn some new strategies for managing different changes as they occur. Everything from the early stage and maybe your loved one recently failed their driving examination, all the way through the later stage of the disease when your loved one may need assistance with getting in and out of a chair or in and out of bed. There's education to help at all points along the way and through a variety of resources. Through Dementia Friendly Prince George's County Northern Sector, who offers frequent webinars on great topics with great speakers. Insight offers education virtually, and there are many other organizations that do as well. And the other big thing here is support for care partners, including, but not limited to, individual counseling, support groups, spiritual support, and or family and friends who really know and understand. Maybe somebody else who's been there too, who's had a spouse or a parent living with dementia, especially if you can make any connections to other families who are experiencing younger onset dementia, who truly understand how you're feeling as these dynamics change within your family. I will say there are many caregiver support groups out there. And so it's a matter of finding one that's right for you. Each support group might have a little bit different feel depending on who facilitates it, the people who come, and sort of the ages and stages and diseases that their loved ones are experiencing. Even the location and the time of day can affect the support group. So finding something that feels like a really good fit for you. And Insight is certainly available to be a resource to you virtually. Our education programs, we offer monthly classes for caregivers on the second Wednesday of the month. Twice a year, we offer a caregiver boot camp. So our upcoming boot camp is on Saturday, May 14th. And actually the director of that younger onset clinic at Johns Hopkins, Dr. Chiadi Anyike, will be one of our speakers for the webinar that morning. We also offer virtual support groups that are free and open to the public, consultations that are always free to absolutely anyone. And for those who are in the early stage of the disease, again, stage, we're not talking about age here, but for anyone in the early stage of the disease, there's a virtual social kind of brain health program called Reconnections that might be of interest. It might be a good social connection for somebody who is feeling like their social circles are changing, maybe recently had to retire from work and is looking for a new sense of purpose and a new community. The virtual Reconnections program can be a great way to do that while exercising those cognitive functions. And I mentioned Insight being a nonprofit, so there are a variety of ways to support us if you feel called to do so. And if you'd like to follow what we're up to, we are on many of the different social media platforms. So check us out on Facebook, some of our videos on YouTube, Instagram, and LinkedIn to keep up with what we're doing and to take part in anything that would be helpful to you or your family. And I've got our website, insightmcc.org, on the screen, as well as our phone number, 703-204-4664. So I hope you'll reach out to us if you have any questions that we are not able to answer tonight. But hi, Pamela. It looks like we've got plenty of time if there are any questions that have come in. So anybody out there who's listening, if you've got a question on your mind, please go ahead and enter it into that GoToWebinar control panel, and I will be happy to take as many questions as we can this evening.
Yes, so if you are able to raise your hand or show a reaction, I can call out your name and then you can go ahead and ask your question. Yeah, so here I have Monica Perry, if you're able to unmute yourself.
Hi, I don't know. I may have raised my hand by accident, but I do want to say thank you for a great seminar. That's a lot of great information of everything that's needed, not only for dementia or younger people using dementia, but just for the everyday person. So it's information that we all can use.
Thank you so much. Thanks for that feedback and for listening in tonight. And I hope that everyone can pick up at least a little bit of something that you can carry with you, because you will encounter someone in your life who's living with younger onset dementia or has a family member who is, and you don't even know. It might be one of your current colleagues, it might be one of your current neighbors, it might be an extended family member. So I hope everyone's picked up a little bit of something here to help you in case this is something that crosses your path. And you're right, a lot of this information too is not necessarily specific to just those with younger onset dementia. A lot of these sort of tips and things to think about can be helpful for dementia at any age, as well as other types of disease conditions that impact families at younger ages.
Thank you so much for that. I have Adam Kruger, if you're able to unmute yourself.
I guess I can. I also just typed it in. So are concussions or other brain injuries also causes of younger onset dementia? Is there a way to discern between post-concussion syndrome and younger onset dementia?
So people who've had traumatic brain injuries or multiple significant concussions can experience dementia at younger ages. So when we think about concussions, that makes me think about CTE, chronic traumatic encephalopathy, which we think of a lot with like football players, boxers, and even military members who may have experienced significant head injuries, while they are in active duty service. And so, yes, and absolutely, and especially being in this kind of DC metro area where we have so many people who are connected to the military, you may know someone who has traumatic brain injury or has had significant concussions and is experiencing these symptoms at a younger age. And it would really be up to a neurologist and the different types of testing that they would do, especially some of the brain imaging, to determine what type of, like what is causing someone's dementia. So for example, if someone is exhibiting sort of a lack of filter, like they're sort of saying and doing things that others would consider inappropriate, they're having changes in executive functioning, like not good decision making, all of those things are frontal lobe issues. But it's really the doctor who has to figure out, well, why is the frontal lobe changing? Is this frontal lobe dementia, like frontal temporal degeneration? Is it due to a head injury that impacted the frontal lobe of the brain? Was there a stroke that happened to be in the frontal lobe of the brain? So it really is the physician who has to get to the root of what has caused these symptoms to occur. And really, when it comes to treatments, just to kind of keep going on this thread, there are medications that have been FDA approved to help treat Alzheimer's symptoms. There has recently been a treatment approved for Alzheimer's that would theoretically change the progression of the disease, though there is some difficulty in getting access to that treatment and also a bit of controversy about that treatment. If someone has dementia with Lewy bodies or Parkinson's disease, there are some medications that can be helpful with symptoms there. Again, not with really modifying the disease process, but with symptoms. But for most other forms of younger onset dementia, like FTD, or if it were traumatic brain injury or something like that, there really aren't treatments other than trying to treat symptoms as they arise. So that might be treating mood changes, like someone who's experiencing depression or anxiety. It might be treating pain, but there's not really, unfortunately, much to do as far as treating an underlying disease. I would say the best things for really any person living with dementia, no matter the age and no matter the disease, the underlying disease, physical and social activity are really the best things that the person can do for quality of life and for sort of maintaining functional abilities. So being with other people, talking with other people, moving your body, those are really the best things that someone can do for themselves. And if you are a loved one, if you're a spouse, an adult child, a friend, finding resources where your loved one can be social and can be physically active and encouraging them to do so, it really is probably more helpful than even some of the medications that are available for symptoms.